Seniors, I am Dr. Anya. If you were completely alone right now and a sudden, crushing pressure hit the center of your chest, would you know exactly what to do? The brutal reality of emergency medicine is this. Nearly 50% of heart attack fatalities happen before the patient ever reaches the hospital. Time is muscle. You cannot afford to panic, and you cannot afford to guess. Today, I am giving you the exact science-backed clinical protocol to keep oxygen flowing to your brain and heart when nobody else is around. Hit that subscribe button right now because the next few minutes could literally save your life. Let's begin. The deadliest mistake seniors make during a cardiac event is hesitation. When that chest pain hits, you might be tempted to look down at your smartwatch or fitness tracker, hoping the device will confirm if it is a real emergency. Let me be clinically clear. Do not trust those commercial devices with your life. I advise my patients to take the numbers these devices give you with a grain of salt. A Stanford study tested 7 popular fitness devices and found profound inaccuracies across the board. They are commercial gadgets, not medical-grade lifelines. If you feel a sudden chest pressure, shortness of breath, or an eerie cold sweat, trust your raw biology, not a screen. Your very first step is to pick up your phone and dial emergency services immediately. Do not wait to see if it passes. Every single minute you wait, permanent heart tissue dies. Once you have made that call, you need to physically intervene. A heart attack is typically caused by a blood clot that is suffocating your coronary artery. Your immediate over-the-counter weapon is a standard 325 milligram uncoated aspirin. But here is the critical medical rule. Do not swallow the pill whole. If you swallow it, it has to travel down into your stomach and digest, which can take up to 15 precious minutes. You do not have 15 minutes. You must chew the aspirin. By violently crushing it in your mouth, you allow the active chemical compounds to absorb sublingually, straight through the mucous membranes under your tongue and directly into your bloodstream. It acts as an instant chemical Clot-Buster, keeping your blood just thin enough to flow around the blockage until the paramedics walk through your door. When you are in the middle of a cardiac crisis, feeling weak and terrified, your biological instinct will scream at you to go lie down in bed. I need you to fight that instinct. Medically speaking, lying flat on your back during a heart attack is one of the most dangerous things you can do. When your heart is struggling to pump, it acts like a failing engine. If you lie completely flat, gravity causes fluid to rapidly pool and back up into your lungs, a condition we call pulmonary congestion. Your lungs will become heavy, and you will physically feel as though you are drowning on dry land. Instead, you must immediately assume the survival posture. Sit upright in a comfortable chair or slide down a wall to sit on the floor, keeping your back supported at a slight angle. The moment you are seated, loosen anything that restricts your blood flow.
Unbuckle your belt, unbutton your collar, and loosen your waistband. By sitting upright and removing physical restrictions, you take the massive gravitational pressure off your diaphragm, allowing oxygen to reach the lower lobes of your lungs with minimal effort. But what happens if your heart begins to fail and you feel that terrifying sensation of the room spinning? Your vision narrows, your body goes limp, and you know you are about to pass out. In clinical terms, this is an impending syncope caused by a catastrophic drop in blood pressure to your brain. If this happens while you are alone, you must deploy a fascinating physiological hack known as cough CPR. If you feel yourself fading, you must take a deep breath and cough violently. I mean a deep, aggressive, forceful cough from the absolute bottom of your chest. And you must repeat this every 2 to 3 seconds. Why does this work? Every time you execute a forceful cough, you create a massive spike in intrathoracic pressure, the pressure inside your chest cavity. This violent spike in pressure acts like an invisible hand physically squeezing your struggling heart. You are essentially performing a manual cardiac massage from the inside out. Each cough artificially forces a wave of blood out of the heart chambers, pushing it straight up your carotid arteries and into your brain. It will not cure the heart attack, but it acts as a mechanical pump, keeping your brain oxygenated and keeping you conscious just long enough for emergency responders to break through your door.
We have addressed the physical clot, and we have stabilized your blood pressure. But survival is not just about biology. It is about the cold, hard logistics of your rescue. You must immediately eliminate any physical barriers between you and the paramedics. If you are sitting in your living room and the front door is locked, you are creating a deadly delay. Emergency responders are trained to break down doors, but doing so takes minutes. And as we have established, every single minute is muscle. If you are physically able, unlock your front door before you sit down. Then, place your phone directly next to you on speakerphone so you can communicate with the emergency dispatcher without having to hold the device to your ear. Do not trap yourself in a back bedroom or a locked bathroom. Make the path to reach you completely frictionless. Once the path is clear, you must face your most dangerous internal enemy, panic.
When you realize you're having a heart attack completely alone, your brain will naturally flood with pure terror. This triggers your sympathetic nervous system, initiating a massive fight or flight response. Your adrenal glands will dump a lethal surge of adrenaline directly into your bloodstream. Medically speaking, adrenaline is the absolute worst chemical you can introduce to a heart attack. Adrenaline forces your blood vessels to constrict and demands that your heart beat faster and harder. Think about the clinical reality of this. Your heart muscle is actively suffocating from a lack of blood, and adrenaline is forcing that suffocating muscle to sprint. This violently spikes your tissue oxygen demand and accelerates the death of your cardiac cells. To counteract this, you must manually override your nervous system using precise, clinical oxygen control. You must perform diaphragmatic breathing. Place your hand on your stomach. Inhale deeply and slowly through your nose, making sure your stomach expands, not your chest. Then, exhale incredibly slowly through pursed lips, exactly as if you were blowing through a tiny straw. By taking these slow, deliberate breaths, aiming for just 6 to 8 breaths per minute, you are doing 2 profound biological things. First, you are maximizing the tissue oxygenation in your blood, giving your struggling heart the fuel it desperately needs. Second, this specific rhythm stimulates your vagus nerve, which acts as a powerful biological sedative. It chemically shuts down the adrenaline dump, slows your heart rate, and prevents you from panicking yourself into a lethal arrhythmia.
Seniors, we have reached the final and most critical medical commandment of this survival protocol. Once you have called for help, chewed your aspirin, and controlled your breathing, you must obey the rule of absolute stillness. When severe pain strikes the body, human nature dictates that we try to walk it off. You might feel the urge to pace the room, walk to the bathroom to splash water on your face, or go out to the garden to find your spouse. Medically speaking, giving in to that instinct is lethal. You must understand the brutal economics of oxygen inside your body during a heart attack. Your coronary artery is blocked. Your heart muscle, the myocardium, is actively suffocating, functioning on absolute fumes. Every single time you take a step, Your massive skeletal muscles in your legs and core require immediate oxygen to move. Your brain has to steal that precious, limited oxygen away from your dying heart and send it to your legs.
Walking around during a cardiac event is exactly like revving the engine of a car that has no oil. You will completely blow the engine. The medical rule is to stay absolutely frozen. Do not pace. Do not fetch a glass of water. Do not try to clean up the room before the paramedics arrive. Tell yourself, I have made the call. My only biological job right now is to stay still, breathe, and survive. By freezing in place, you reduce your tissue oxygen demand to its absolute baseline, giving your heart the greatest possible chance of holding on until the defibrillator and the oxygen masks come through your door. Listen to me carefully. Surviving a heart attack alone is not about luck. It is about clinical preparation. True longevity and extending your lifespan are only possible if you know exactly how to handle these critical medical emergencies before they happen. I want you to take control of your cardiovascular survival right now. Make your vitality pledge. Go into the comments below and type the powerful words, "I am ready to protect my heart today." And while you are there, I need to know your emergency plan. Do you currently keep uncoded 325 milligram aspirin in an easy-to-reach place in your home? Yes or no? Let me know. I read every single comment, and your preparation could inspire someone else to save their own life. If this masterclass gave you the actual science to survive an emergency, hit the like button. You must share this video with your spouse, your friends, and anyone you know over the age of 60 who lives alone. You might literally save their life. And if you haven't already, hit that subscribe button and turn on the notification bell so you never miss a week of cellular healing and life-saving medical truth. I am Dr. Anya. Guard your health, honor your biology, and I will see you in the next video.